What causes diarrhea after eating? Diarrhea is when someone has loose, watery stools or bowel movements. When this occurs after eating, it is known as postprandial diarrhea. Postprandial diarrhea or PD can happen quite unexpectedly. It can also cause discomfort or pain until a bowel movement occurs. PD is relatively common, but it may be difficult to figure out what is causing it and how to treat it. The reason for this is that PD can be a sign of a medical condition, or it can just happen with no specific cause. Diarrhea is either acute or chronic, depending on how long the symptoms last. Acute diarrhea lasts for only a couple of days or weeks. Chronic diarrhea, on the other hand, can last for several weeks or months. In this video, we take a look at the causes of both acute and chronic PD, along with what can be done to treat and prevent them. Causes of diarrhea. There are many different causes of PD or diarrhea after eating, depending on whether it is acute or chronic. Acute PD. Acute diarrhea usually lasts for fewer than 14 days. It is either treated with medicine or left to run its course. It can be caused by infection. A viral infection, such as stomach flu, is the most common cause of acute diarrhea. Food poisoning. Food or water that is contaminated by bacteria or other germs can cause diarrhea. Eggs, poultry, soft cheeses, or raw foods are the most common culprits of this type of infection and diarrhea. Lactose intolerance. Some people have an allergy to milk or are not able to digest lactose, which is the sugar in milk. This means that if they drink or eat milk, it can cause diarrhea, cramping, and gas. Parasites. Some parasites, most commonly found in food, can cause acute diarrhea. The symptoms tend to last until the parasite is identified and removed. These types of parasites are not common in developed countries and are usually contracted while traveling. Toddlers' diarrhea. Acute diarrhea is common in young children who drink a lot of sugary drinks, such as fruit juice. The high amount of sugar causes water to enter the intestines, making the stool more watery. Antibiotics. Some antibiotics can cause a stomach upset and acute diarrhea. The symptoms tend to resolve once the antibiotics are stopped. Chronic PD. Chronic diarrhea is diarrhea that lasts for at least 4 weeks, with a minimum of 3 loose or watery bowel movements each day. Potential causes of chronic diarrhea may include irritable bowel syndrome. Irritable bowel syndrome, IBS, is a disorder of the large intestine, causing bloating, cramping, and either constipation, IBS-C, or diarrhea, IBS-D. IBS is a relatively common condition. Usually, it can be controlled with dietary changes, medication, and stress management strategies. Inflammatory bowel disease. Inflammatory bowel disease, IBD, is an autoimmune disease, where the immune system causes inflammation and irritability in the intestines. Crohn's disease and ulcerative colitis are 2 examples of IBD. Both cause persistent diarrhea, cramping, weight loss, and tiredness. Endocrine disorders. Some hormonal disorders, such as hyperthyroidism and diabetes, can cause chronic diarrhea, especially if there is nerve damage to the intestinal tract. Celiac disease. Celiac disease is an autoimmune disorder that prevents people consuming gluten, the protein found in wheat and wheat products. People with this condition have diarrhea whenever they eat food that contains wheat, barley, or rye. Prevention. Not all kinds of diarrhea are preventable. Hand hygiene and avoiding offending foods can go a long way toward preventing some causes of diarrhea. 2 forms of diarrhea can be prevented. Rotavirus is a virus that causes diarrhea in young children. Most babies are vaccinated against the virus during infancy. Only eating well-cooked food or drinking purified water while traveling can prevent travelers' diarrhea, which results from exposure to contaminated water or foods. You might also want to watch how to immediately stop diarrhea. We go over powerful way to stop diarrhea fast at home. Make sure to like, comment and subscribe. See you on the next video.